here's something new for you. I don't know whether you agree or not. Yeah. I'm saying that clinical psychology is incomplete without parapsychology. Parapsychology is incomplete without clinical psychology. Okay, let's leave out the existential part for the time being. Okay, you know why? Anybody know why? Do you want me to give you the answer? Now, if you only focus on the symptoms, clinical, that's not a good way to treat people. Do you know why? Because that person will not have the resources and the strength to overcome the symptoms. So it's just dealing with symptoms, your result is limited. If you incorporate parapsychology by trying to develop their personal strength, cultivate their inner resources, the inner immune system, the psychological immune system of faith, meaning, and relationship. So those three are immune system. You are able to develop the immune system and develop the character strength. They're better able to overcome the symptoms. So that's more effective. Similarly, parapsychology is incomplete without psychology. Because if you only focus on happiness, focus on the character strength, and ignore your shadow, ignore your existential anxiety, pretend it don't exist, ignore your past, no matter how much trauma you have in the past, it doesn't work. You're developing all your energy to develop happiness, but your past, it comes to catch you. That's why some people get in trouble because they haven't dealt with their demons. They haven't dealt with their inner demon. So for parapsychologists to really work, they really need to have to go through the gate of hell to deal with all the nasty stuff and come out and then become real positive. And so that's why you got to put them together. So right now, I need your help. Because I'm the lone voice in the wilderness. Nobody listens to me, except you, right? They ever say, oh, they're two separate disciplines. Don't mix them up. Clinical is a symptom. Parapsychology is happiness. No, they need each other. Okay? They need each other. You see? Do you know why meaning therapy is pluralistic? Because almost everything about human being has to do with meaning. Remember I said meaning is all we have, right? We have cognitive meaning, your thinking. Your narrative meaning, the story you live by. We have unconscious meaning, the idea you suppress. We have cultural meaning, the shared values, norms. We have motivation meaning, we have values, aspirations, intentions. We have existential meaning regarding the meaning of life. Okay? So meaning therapy deals with all aspects of meaning, right?